Welcome back to Studio 10. A few weeks back, we introduced a segment called On Your Health. It's our chance to discuss important medical and health topics with the doctors of Florida Medical Clinic, the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof.
And joining us today to discuss, among other things, the importance of being screened for colon cancer is Florida Medical Clinic gastroenterologist Dr. Dennis Feldman. Hi, Dr. Feldman.
Hi. It's a pleasure to be here.
Nice to have you. We talked about this during the last segment that we did about how Florida Medical Clinic really ahead of the ball, ahead of the curve, I should say, in regard to electronic record keeping. I mean, you guys have understood that for a long time. Explain the advantage of that to the viewers.
Well, Florida Medical Clinic was an innovator of electronic medical records, being one of the first clinics in the country to have a paperless medical system.
Why is it important if it's paperless?
Well, for one thing, I've been in practice for about 25 years, and in the old system we had an individual chart, and if I wrote a prescription for a patient, then all the other activities that were required for the care of that patient waited until I wrote that prescription. Now, with an electronic medical record, I can be reviewing the chart, a cardiologist could be reviewing the chart at the same time simultaneously. The physician assistant who's responsible for sending prescriptions to the pharmacy can, at the same time that I'm working on the chart, work on the chart and electronically contact the pharmacy and get a prescription written for the patient immediately.
Do you have doctor handwriting?
Yes.
You know what I'm talking
about? Worse than most.
Well, so it is good. I mean, so there's no...
It's very legible.
Yeah.
The information is of immediate access to multiple subspecialists and primary care physicians simultaneously. It prevents what physicians refer to as leakage, in which there is redundancy of care where laboratory tests are repeated by multiple physicians simultaneously. By having a common medical record that's accessible to the entire clinic, the patient's insurance care, drug interaction issues, care by multiple consultants simultaneously can all be achieved at one time.
And being a specialist, Dr. Feldman, how often do you find that your patients are seeing several doctors at one time?
Well, obviously, you know, it takes a community to care for one patient. Patients don't come in with just one disease. Many of the patients that we see have complex medical problems affecting multiple systems at the same time. Frequently, a patient who requires a colonoscopy for diagnostics is also somebody who is under constant cardiological care. So by having a common medical record, these efforts can all be worked on simultaneously.
So you're a gastroenterologist?
Correct.
And what is that exactly?
A gastroenterologist is a physician who is trained in internal medicine for 3 years and then done an additional 2 to 3 years of training to handle complex diseases of the esophagus, stomach, small and large intestine, liver, and pancreas. He's also done additional technical training in the field of endoscopy, where equipment is used to analyze, diagnose, and treat diseases of the esophagus, stomach, and colon.
And what are some of the prevalent diseases that people hear about quite commonly that you deal with?
Most gastroenterologists have a broad area of care where they take care of people with complex medical issues such as hepatitis B, hepatitis C, inflammatory bowel diseases such as ulcerative colitis and Crohn's disease. They also serve other physicians to help diagnose and treat patients with complex forms of anemia, unexplained weight loss, and malnutrition.
Are there any lifestyle changes that any of us could make in regard to preventing the risk of colon cancer?
There are, but I must emphasize that the most important factor in developing colon cancer are genetic factors. So even if someone leads a very healthy lifestyle, they must realize that as healthy a lifestyle as they lead, screening is the most critical issue in terms of determining who may develop colon cancer. If we find those people early on, we can prevent a significant number of patients of having colon cancer. As far as answering your question, the important lifestyle issues include obesity contributes to colon cancer. People with a large amount of truncal obesity have a higher incidence of colon cancer due to the carcinogens associated with having a large body mass index. Like other illnesses, smoking and alcohol play a significant role in causing colon cancer. As far as preventative lifestyle, keeping a low body mass index, high fiber diet, a diet that's rich in antioxidants, including multiple fruits and vegetables, are important. And actually, calcium supplementation seems to have a lot of impact in preventing colon cancer.
And Dr. Feldman, what's the difference between endoscopy and colonoscopy, and which one is most effective in determining whether you are at risk or dealing with colon cancer?
Well, an endoscopy is a generic term for any endoscopic exam of the esophagus, stomach, or bile ducts.
So the more upper regions.
Yeah. A colonoscopy is a more specialized term referring specifically to an examination of the colon.
Okay, and if you are genetically predisposed to colon cancer, when should you have that first colonoscopy?
Well, people who have a positive family history of colon cancer in their family, first-degree relatives, should actually be examined 10 years before the index case in the family. So if a parent has colon cancer at 45, the child should be examined at 35. For the rest of us who are of average risk, an examination should be conducted at age 50, since the incidence of colon cancer increases with age, about 3.7 cases per 1,000 per year, increasing from age 50.
So if any of our viewers want to contact you or FMC about getting a screening, how does that work? Should they call and ask for you specifically, or how does that work
They
exactly?
can reach the clinic at www.floridamedicalclinic.com, or my office is area code 813-972-2324. We have a dedicated group of 9 gastroenterologists, all with greater than 25 years experience to care for the patients.
So if they don't happen to get you, they're going to get somebody who can help them for sure.
Right.
All right.
Well, thank you, doctor. And if you'd like to learn more about the latest advances in patient care and medical research, visit Florida Medical Clinic online, as we said, at floridamedicalclinic.com. While you're there, you can locate the office nearest you, learn about their doctors, and even, as we just said, request an appointment. Thank you, doctor.
Thank you very much.
All right, road safety is going to a whole new level thanks to OnStar. Up next, find out how you can get OnStar no matter what brand of car you're driving. We'll be right back.
This segment was sponsored by Florida Medical Clinic.